I'm into the part four of my talk. I could have been a lecturer, seeing I'm doing such in-depth discussion. So, I'm doing a part four now about my discussion on the pharmacy and the health sector. So, I was saying that the pharmacist has to relate to other um, colleagues in the health profession. He's a microbiologist. He has to detect the kind of infection that is the patient carries if he's a carrier. This bacteria or germ is then given to the doctor who identifies the medicine that would annihilate or lysize the bacteria, cause a lysis of the bacteria. So then that would go to the pharmacy and he would give the proper antibiotic or anti-infective. If it's a fracture, he will go to the radiography department. The radiographer will diagnose whether or not it's a fracture, whether the doctor, he has to do osteocare, orthopedics for casting, for the fracture, realignment of the bones, and so on. And then they would come down to the pharmacy to get some clindamycin bone infection medicines and some calcium and some Panadol pain relievers, maybe a little sedative. So that's a combo, you have to know the drugs for what situation. That's why they go through a period of training, what they call intern. The pharmacy culture, the medical culture goes on. It's a culture by itself, interaction, a way of life in which you live in the community and you assimilate, you acquire knowledge from elders and seniors. You have to acquire the instinct and the sensitivity of the culture, and in this way your knowledge will expand, your being, your bearing, your becoming will all be enhanced. So never so often there are not so many compatibility in the health system. This can be due to ethnicity, this can be due to background, culture, educational development, and so on. So we have people from Queen's College. If you're from a top school, you might want to dominate people who come from the lesser schools. If you're a doctor or you're a microbiologist or a nurse, if you're a senior nurse or midwife and you're working with a pharmacist, you say, I'm senior, I'm a midwife, or I'm a staff nurse. He's just a dispenser. I remember when I was doing my diploma, there was a nurse who was living right next door to me here in San Road, and she was doing the pharmacy, but she couldn't come through with the course. She left maybe in the second years. Mr. Jeffrey can tell you that. She didn't make the course. She just left. Right? And so it's a complicated program and it has its own complications. We have to do biostatistics in the degree year. In the masters, you have to do more biostatistics with graphs and so on as it relate to blood serum, blood in the body, and dosages and so on. So it's not we could say a profession that is as easy as any other profession. In fact, it was rated at one time, pharmacy was rated as one of the most difficult courses in the university. Right? But then human sentiments and human feelings, they percolate everywhere. And we have to meet them, we have to deal with them. Sometimes you say something you don't like, For example, one day I was doing a clinic in my pharmacy and the supervisory head came in and he saw the tablets out on the outside, and they're supposed to be in the store carriage, the store cupboard, the store room, properly stored. When locked, the cupboard should be locked. And he came, he saw the pharmacy was in a little bit of a disarray, books on boxes, medicines outside, cupboards open, and he was upset. But he has on the sign it was a clinic. I had to tell him, I said, because a clinic, that's how I select that. And then the issue of commitment, regularity, and finishing your job quota for the day all have to be met. They got to meet all of these, and you have to do them, and so on. Sometimes you have a supervisor or a head of department who doesn't stick to the word. They say they want to come for a meeting tomorrow and they don't show up. They can't come. I remember once somebody seen your phone and they called. They said they're coming to visit us. But later on in the day, they said the program is cancelled. We have to look at the safety of your place where you're working, occupational health and safety. Regularly, they have to test for infestation, animal infestation, parasite pests, rats, cockroaches, carriers. These can be carriers. We have to make the place sterile, disinfected. We have to look at this structure, the situation with the building, whether it's healthy, whether it's rotten, it's breaking down and it's going. So all these plays a part, you know. And most of the time in the profession, when you have a young supervisor, a new head of department that is very young and very ambitious, very enthusiastic, has a lot of energy, they might throw off senior pharmacists off, you know. So that's why the supervisor has to know how to put his staff together, proper placement. People with a likable background, people with compatible background, people with compatible training, with maturity could be helpful if they work together. They will make things better, you know, work, the more output, you will get a better output. What is it to say that you put a pharmacist in the worst of situation? For example, you place a pharmacist just solely among women. He's a male, just among women. And then not the best quality of staff either, and then you expect the best. No, this would say that it's a challenge, a very challenging situation, you know. So we have that not always a supervisor, a head, or co-worker may have the depth of knowledge or the depth of thinking to see into a situation or potential issue, you know. People tend to lose patience and transfer their staff at the least provocation to satisfy the larger body or the larger health population. They transfer, they move, and the discipline without any returns or any retribution, you know. So sometimes people have to work under different sort of condition, and in this case, the team spirit comes into play. It is helpful. So where we have a pharmacy now, where we have a crisis, where the doctor has to be ahead, and it has to be declared and made legitimate that it's a crisis, and the doctors are holding as heads, temporary heads, or supervisory for pharmacists. Until this situation is straightened, they will may have to hire proper healthcare workers, pharmacists, and so on. But a pharmacist, he gains his knowledge generally depending on the area that he works in, the ethnicity of the area. So certain diseases might be more prominent that he will become more familiar with. If you work in a hospital setting, certain diseases and challenges will be. The pharmacist is attached to the psyche ward, or just clinical pharmacist, then he will deal more with terminal illness and crisis situations. So his knowledge varies depending upon the areas of expertise he has to work in, or the most dominant disease factors that he has to deal with daily by daily. So it's like that people gain experience in one or more areas depending upon the department they work. Even among the doctors, they have to specialize. You can't learn everything at one time. From general medicine, you move down to specialist medicine, where you work in a field and grow in that field, whether it's skincare, dermatology, or psychiatry, or cardiovascular diseases, and so on. You work under senior supervisors and they pass the knowledge to you. In this way, you get more and more knowledge every day. So there's my few concepts about my discussion about some aspects of pharmacy as it relates to other healthcare bodies in the profession. a pharmacist or all elderly pharmacist, he can write stories about his experiences, which can help young people. Maybe we can start doing this, writing books in various areas, which can be helpful to young pharmacists coming up. Thanking you. Have a pleasant day. Namaskar.